Welcome to Your Health Matters. Today we have Dr. Louise Ackey with us about taking medicine safely. Dr. Louise Ackey,
Good morning, John.
how are you qualified to talking about taking medicines?
John, I've been a pharmacist for over 30 years, and I've seen a lot of medication misadventures when sincere people try to do the right thing and something bad happens. Many of us have been taking medicines, but sometimes things go wrong. My book helps you understand medicine so that you can protect yourself and your loved ones.
So you have a book,
I do.
and it's titled?
It's called Why Dogs Can't Eat Chocolate, How Medicines Work and How You Can Take Them Safely.
So you've seen lots of side effects in various people.
As a pharmacist for over 3 decades, yes, I have.
What kinds of side effects?
Many times people will start a medicine and it doesn't work right or they don't feel right, but they never speak up and they suffer. And you hear about it afterwards and you think, why didn't they say something to the doctor and get it fixed? Others do not tell their doctors what they're already taking, and so they get the same thing or something that should never be added to a medicine that they're already taking, and something goes wrong.
So interactions are important, so you have to have some knowledge about what other kinds of things. Because I hear about citrus fruit and medications. Are there explanations given when you have medications that react with, say, grapefruit?
Yes, grapefruit has some special properties that can interact with medicines and actually increase the amount that gets into your body.
Oh, they make them better.
Make it more powerful. Sometimes that's not such a good thing. Your pharmacist can help you with that. Your doctor doesn't always understand that, but your pharmacist is the go-to person for that.
So the pharmacist is supposed to know everything about every medication.
We know a lot about a lot of medicines, yes, but we want to make sure that you understand when to ask and how to ask, because that's so important. If you don't ask or know what to ask about, all of the information, all of the expertise that a pharmacist has, it's just not available to you.
And how much comes on that page of fine print you get with medications?
Oh yes, the fine print. A lot of people read that and they get so scared they don't even want to take the medicine. The most important thing, if I can ask everybody to do this, if you're on a medicine, is to keep a current list of all the medicines that you're on. That's the one thing that if you do that, then every time you access our medical system, ask for medical care, the provider, the physician assistant, the surgeon who's taking care of you will be informed. Most of the biggest tragedies and preventable tragedies happen when the doctor doesn't know what the patient is already on or has already tried and had problems with. So a current medication list is the most critical piece to keep yourself and your loved ones safe from medication problems.
Now, does that include stuff that's just over the counter, that's supposedly safe?
Yes, if you don't tell your doctor that you're taking a leave every day, they may give you a prescription medicine that is exactly the same as a leave but more powerful, and taking them together can cause serious problems with bleeding or serious problems with your kidneys.
Ooh. And how do you tell if you've got kidney problems then?
Usually your doctor will pick it up.
Okay. So you have to be careful of which medications you take and tell everyone what you're taking.
Definitely. Again, the most important thing you can do to stay safe is to make sure that every time a doctor, specialist, surgeon starts you on a medication, or if you're starting a herbal supplement, food supplement, or over-the-counter prescription, you have it on that list so they have a complete record of everything you're currently taking. Oftentimes they'll look at one of those medicines and say, oh, you're here to see me about that? Well, you know that medicine can cause that. When did the symptoms start? And if it lines up to when you started that medicine, then the mystery can be solved. And instead of adding a medicine for a side effect, they can take something away and make you feel better.
Uh-oh, taking less medication? What's a doctor to do?
Well, as a pharmacist, we understand that more medicine is not always better. Just because we push medicine doesn't mean we want everyone to be on more.
How do you watch for side effects?
One of the most important things is if you don't feel right, to speak up. Too many people suffer in misery for years. If a cardiologist starts you on a heart medicine, if they don't hear back from you, they assume everything is fine. Many people feel tired, listless, cannot hardly get off the couch, or they have muscle aches, and they put up with it because the doctor knows best.
Or they think that's supposed to happen.
Yes. And many times, the doctor, not knowing that there's a problem, can't help them unless they speak up.
So speaking up may make a change in what medications you take.
Absolutely.
And so you have to watch for different side effects then.
We're all so different. Not everyone is going to have every single side effect, thank goodness, but some of us have different side effects than others, and many of us don't have any side effects at all.
Now, do things you apply to your skin make a difference?
They can, though most of the time if you're putting something on your skin, it's not going into your body completely, and it's less likely to cause problems.
So there's a place where some things are supposedly safe?
Safer.
Safer. So how do we expect side effects or bad things to happen with medication?
One of the other things that you can do is ask your doctor and ask your pharmacist, what is this medicine supposed to do for me? And what kind of problems would you want to hear about if I did have them? And so they can tell you if you are having shortness of breath, if you're very, very tired, if you get a rash, that type of thing, you want to call back right away. And your pharmacist is an excellent resource. One of the tragedies of our current medical system is that we drive everybody to mail order pharmacies where there's not a real person to talk to.
So what's the most important thing to remember about taking medicines safely?
Make a list, keep it updated, and show it to every medical provider. And make sure your pharmacist has that medical list of your medicines as well.
Well, thank you, Dr. Louise Ackey, for joining us today with Your Health Matters and teaching us how to take medications and medicines more safely. Have a good day and good health.
We did it.